COVID-19 disrupted life-saving immunization services across the globe. Millions of children either skipped their routine immunizations or were unable to access these services due to the various COVID-19 restrictions. I'm Dr. Masi Korir, and on KTN News Health Watch, our health and science reporter Beldin Waliaula takes a look at how the pandemic reversed the gains made over many years in trying to combat deadly childhood diseases through routine immunizations.
When COVID was actually announced as a pandemic, one of the first things we did, and even as healthcare givers, we told people, stay away from medical institutions. In fact, lock yourselves up. The downside of that is that people became so frightened of actually visiting health facilities that even the routine visits for children who require their vaccinations early did not take place.
Parents not being able to take their children to hospitals for immunization due to perceived fear of contracting the virus had the Ministry of Health coming out and assure mothers that routine treatment and immunization is still taking place despite the existence of coronavirus.
Maternity and child health services are ongoing. Hospitals are continuing to offer delivery services, cesarean section services, child health services, immunization services. All these services are available.
Before COVID-19, Kenya had made significant progress when it comes to immunization coverage of preventable childhood diseases. The public health interventions through the Kenya Expanded Program on Immunization, KEPI, had seen a reduction of these diseases.
They actually say after clean water and sanitation, immunizations are the next most important disease control measure. So we've made a lot of progress as regards immunizations and vaccinations. And some of the diseases that many people will know are the TB, the BCG that we gave at birth, things like hepatitis B, things like pertussis or whooping cough, things like polio, and people will know about polio and so forth. We have things like meningitis and things like pneumonia. Many diseases have been actually effectively controlled and checked by immunizations.
For people who care about childhood death, vaccines are the best thing that ever happened. You know, smallpox killed over 1 million people a year, and because of vaccines now smallpox is gone. You know, the miracle of vaccines is very clear, and you know, it's when a child dies, that's a very clear thing. You know, we have very good statistics on what that was like before we got these new vaccines. Over 10 million children dying under the age of 5 every year, with a high portion of those being in Africa. And so, you know, the more people learn about vaccines, the more amazed they should be about how fantastic they are.
Normally, children are vaccinated from birth to 9 months and beyond. Kenya vaccinates its children against TB through BCG immediately after birth. Polio, hepatitis B, tetanus, whooping cough, influenza, measles, among other vaccines options such as rotavirus and cholera through an age-specific schedule.
Most children will get the first vaccinations early, like the first 6 weeks. We give them at birth, 6 weeks, 10 weeks, 14 weeks. Then we go 6 months, 9 months, 12 months, 15 months, depending on what other vaccines there are. You tend to find that children will follow up fairly closely, or the parents bring them fairly closely, so that when you look at vaccination coverage, you have to say, is it at DPT2, the second one, or DPT3, right? When you look at the DPT3 coverage, it varies. Some places have very high coverage rates, meaning that the parents consistently bring children to the hospitals. And if you look at the country in general, you'll find certain areas have 85–90% coverage rates, 95%. Some areas, particularly the far-flung areas and so on, the remote areas, this may fall between maybe 50, 60, and so forth, right? When you're talking about vaccines that are given later, you find the coverage is even less. For instance, The last vaccination that would be given in the public sector used to be measles at 9 months. So you find when parents have had their child getting their measles shot at 9 months, they say, tulimaliza, we finished. Right? But that's not true. There are some vaccines that actually come after that, particularly now that we're giving the second dose of measles. And we have other activities where we need to vaccinate the children to cover those that were not caught in the first visits that were supposed to have made.
COVID-19 disrupted the usual supply chains. Transport delays due to lockdowns limited supply of vaccines.
Immunizations, vaccinations are made in centralized places. They have very stringent ways of being produced and being stored and being sort of supplied, right? From the factory to the arm means that you have to have the vaccine in a certain status, right? When the supply chains are disrupted, then it means that we are not able to get those vaccines in time. And you know, we have about 1.5 million children born every year.
Mass vaccination campaigns against diseases such as cholera, polio, and measles were put on hold due to a need to maintain physical distance during the early stages of COVID-19 pandemic. According to the World Health Organization, WHO, measles vaccination campaigns were suspended in 27 countries and polio campaigns put on hold in 38 countries.
About the door-to-door campaigns, those in technical terms we call them supplementary immunization activities, in short SIAs. SIAs are designed to mop up people who did not get their vaccinations using the routine way. Remember, people get their vaccinations by going to their health centers or dispensaries or hospitals, institutions near them to get the vaccinations. We know a few of them don't do that for all sorts of reasons. Measles requires very high coverage rates for you to have what is called herd immunity. In other words, the more people are immunized, the less the chance that somebody is going to get a disease. So you sort of benefit from the immunization status of the other people. So if this is falling below 80%, 85%, I think that's the number, then you have a chance of getting the disease breaking out. Okay? So supplementary immunization activity is meant to reach out to those people in hard-to-reach areas. Hard-to-reach areas is not just the rural areas, it's also some of the inner city. Right, some of the slums where people have all sorts of difficulties, social economic difficulties. They do not get their vaccinations. They may fail to come.
COVID-19 pandemic threatens to unwind decades of progress against vaccine-preventable diseases like measles and polio.
It's definitely a tragedy that those coverage levels have gone down. In fact, they've gone down to a level that we last saw about 20 years ago. And so this is something where, as you say, we need to get those primary health care vaccine delivery systems for routine immunization back functioning again. And that, requires political leadership. Mostly politicians don't think about vaccine coverage in the primary health care system, but we need their support to get real focus on, okay, what is the data? Which parts of the country have fallen behind? How do you do these catch-up campaigns?
From the experience of other pandemics, experts warn that missed immunization could lead to a bigger public health catastrophe than the one we are trying to contain right now.
There are more deaths that came from the fear and failure to follow up than from Ebola itself. So one has got to be measured in terms of what you tell people what to do regarding routine care. So we are now trying to claw back and say, yes, it's important that children get the vaccinations near where they're coming from. These children are generally healthy, and if they came and didn't have to spend a lot of time on the queues, then that's an important thing. So we are trying to get people to come back for their routine immunizations and vaccinations. So in general, I don't have the figures off the top of my head. You'll find that the vaccination rates actually came significantly down, maybe 40%, 50%, depending on the various areas. Some of them, remember, were up to the 90%. So we have lost a lot. The effects of this will be felt probably later when you have lower coverage for immunizations like measles. Then we begin to get measles cases, begin to have more and more. That will come a couple of months or maybe a year or so down the line.
As we continue to adjust our lives to living with COVID-19, there's a need to mitigate challenges brought by the virus in case of another pandemic.
To anticipate that these things are going to happen, if you have a situation where people cannot get to the nearest hospital or the nearest place where they get the vaccination, is the messaging. How are the messages passed, right? Is the system able to deliver the vaccines near home, for instance, in terms of costs and personnel and so forth? So we have to be nimble and agile in the way we make decisions when we have to meet people who can't get out of their places or they have lost jobs for all sorts of reasons. So we have to adjust.
Likewise, in Africa itself, these health issues deserve a lot more attention. The press looking at those figures and highlighting it, I think, may be a helpful factor in driving action there. But, we need to catch up on all those key vaccines, even things like the measles campaigns. We still have a type of polio virus that we're still working on. And so I've been talking to leaders about how we get those campaigns back underway again. So we have to build back, as over the next year, the epidemic and all of its impacts, including the economic impacts, slowly go away.
One of the things that COVID has shown is that when there's scarcity of resources, people become inward-looking. They think about themselves and so on. They do not want to give those people whatever they've been getting, because we also have a shortage here. So we need to be able to say vaccines are important. What is the total number of children that need these vaccines? And the good news is that once you've gotten your complement of 3 doses of your pneumococcal vaccine, you do not need more. We do not give you bakshishi vaccines. So you can factor for that. So we need to re-engineer our thinking and say, how do we enable ourselves to get immunizations and vaccinations to stop our children from dying from vaccine preventable causes.
Quarantines, curfews, restrictions in movements, some of the COVID-19 disruptions that affected routine immunization for children. These effects might be felt this year. And to avert another public health crisis, these vaccinations have to be prioritized once again. For Health Watch, I am Bildin Walyeula.